California's first Surgeon General has been appointed to really address this issue, as this has been something she had been working on for years. And when you think about homelessness and you think about, and we're talking about what causes homelessness, what are some of the key drivers? And there's been a lot of research done on this, and it shows that domestic violence and mental health and substance use, which we will talk about in a little bit, really work hand in hand. And when you put childhood trauma on top of that, the issue is just so large, and where do we actually start? So she's going to be driving this agenda forward, and Dr. Grover, who's going to speak after me, will really get into the details of a lot of that. Just quickly to put things in context, there are 10 issues that we address when we're thinking about an ACE score, and it's talking about abuse, neglect, household dysfunction. It's very similar to doing a depression screening, where you answer a question, there's a score that you get at the end, and this really addresses, childhood trauma. And when you look at these, you sort of think about all of the issues that are impacting. And I can tell you, over the years, I've taken care of kids whose parents, whose grandparents have been patients of mine. So that cycle has continued, and we're so blessed now that we're actually going to be introducing this concept into the clinical world, where we're going to start to ask those questions in the doctor's office so we can think about how we address it. We at Illumination Foundation started doing this 10 years ago, because when we were thinking, what's actually happening with these kids, we were, Paul met Dr. Harris back then, and we started to actually address those issues, but now we're going to be working closely with our clinical and academic partners to really address this issue. And Dr. Grover will go more into the neurobiology and all of that fun stuff that we in clinical need into more about ACEs. So just to sort of pause for a second, why this is an issue, why we need to talk about it. In California, upwards of 60% of adults have at least one ACE score, and 16% have 4 or more. This is adults. We're looking at this issue lifelong, and you'll hear more about this, but if you have a score of 4 or more, you are exponentially at a higher risk of medical issues, chronic diabetes, hypertension, mental health disorder, and also you are at a risk of dying 20 years younger when you have an ACE score of 4 or more. Just to get into a little bit of the detail, we always talk about the causes of homelessness, who are homeless, and, there's a lot of disparities. Is it more people of color? What does that look like? This pie chart gives you a visual of ACE scores in California, and I want to point out to the purple side of the pie chart where you can see, it's really all walks of life and all backgrounds. So when you look at the proportion for white, African American, Hispanic, or Asian Pacific, they're kind of similar. They're not that different. And this is sort of more going back into how it's affecting our kids. When you look at an ACE score 4 or more, at anybody who's had that screening done and they have an ACE score of 4 or more, at the age of 15, they're sexually active, and they are parenting at that age, given the trauma they've had to experience over the years. And thank you to the healthcare agency and the county, who just released a report on the Orange County Children Condition Report, which just brings the issue at the forefront again as to why addressing childhood trauma is such a key issue for us, and we need to be coming together to address that. 1 in 5 kids in Orange County have a diagnosable mental illness. 150,000 children, are needing the diagnosis. There are folks that are out there, kids that are in the system, but there's over 150,000 kids who still are not being in treatment for these issues. Hospital rates, and this was compared back to 2008, for mental illness for kids increased 87% when they looked back to 2008 and did a comparison as of where we are today. And sadly, suicide was the second leading cause of death for the age group 10 to 24. 1 in 5 kids in Orange County go hungry, and they suffer from mental health illness. And 1 in 3 children lack the reading skills to start kindergarten. And I'll go into a little bit of how we're seeing that in our organization. Here's more statistics, just comparing to where we were and where we are today. Back in 2008, there were about 22,000 kids that were insecurely housed. And when we think about adverse childhood experience and homelessness in itself is a traumatic experience. And that number back in 2008 was 22,000, and just the recent report released is close to 30,000 kids that are experiencing insecure housing. And of that, we think about what does that mean. Here in Orange County, there's about 26,000 that are families and kids that are doubled up or tripled up. There's another 1,400 kids that are living in hotels or motels, and another 1,300 or so that are insecurely housed and living in shelters. Last year around this time, we were just getting ready to open a navigation center in the city of Anaheim. And I remember our opening day, our goal was we were going to take about 80 individuals. And within the first 4 hours, we had 5 families that walked in, 3 single moms with little ones walking into our door who had been either living outside in tents or living in their cars. And this is just any of the visual folks out there. You can just see sort of the numbers creeping up in terms of kids that are insecurely housed. It was 22,000 back in 2008, and now we're up to 29,000. So a little bit about what we're seeing. Again, we started doing this 10 years ago. No one mandated us that we needed to do the ACE score, but we really were trying to pinpoint what is happening with the kids that are coming through our program. What can we do? And we went ahead and adopted the ACE study and started to screen our children for ACE scores. So as of yesterday, we had close to 500 children in our program. We've served over 3,000 kids over the years. 92% of our kids have an ACE score of 6. And just to pause for a second, if you have an ACE score of 4 or more, that takes 20 years off your life. Our average ACE score is 7.3. And 80% of the kids that we're seeing, their family, there's medical issues, mental health issues, substance use issues, and 87% of the children have been separated from their caregiver. We see a lot of kids coming in who, have never really been reunited for whatever reason with their family. They started off in a foster home, came to us, and now, have been patients of ours since they were 2 years old. 71% of the kids have definitely witnessed domestic violence, and 72% of them have a parent who was incarcerated. So we run family emergency shelters in Orange County, and we just opened our second family emergency shelter a few weeks ago. Currently, there's about 180 families that are waiting, that are on a list to get into housing. So this, just speaks to who we're seeing in the family shelters. And one of our shelters has kids that are in the age group of 0 to 5. So the average age group in that shelter is 3.5, and the ACE score for those kids is 4.12. I need to hurry up and make up for time here. A little bit about our model. We have therapists, counselors that are working closely, in our family shelters and in our housing to really meet those needs of those kids, because they are not accessing the mainstream system. And we have families that are moms that are fleeing domestic violence, so they are not going to go to the doctor's office and where they might have a fear of losing their child. So we provide those services on site at our programs. We have a lot of partnerships. Chapman University, we have speech and language pathology that will come in and work with our kids to really address the milestones. We do parent and me classes. When we talk to the mom and dad about, milestones, they have no idea what that is. So some of this data just speaks to the progress we have made with providing those services within the walls where they are sleeping. Partnerships, we'll hear more about that, are really the key. We're working closely with the school district, Schools on Wheels, other organizations that really address this issue. And most importantly, we've been very fortunate to have Dr. Grover, who will speak after me, to really bring this point forefront and work with the medical community in addressing this. I will skip this slide to make up for time and call up my next speaker. I'm now going to be the moderator since Sue is outside speaking.